So excited.
How are you?
Good. How are you? Leslie, I'm
Good.
so sorry. I am so sorry about the technical difficulties, but
I know
we're nurses, so we muscle through.
we did. I was thinking of myself in the ICU and it wasn't working, and you'd get in there and try to figure it out.
And here we
Oh, this is.
are.
I'm so glad. I'm so sorry. We were
No,
trying
no,
everything.
it's not your fault. I'm telling you, it's something that happens with Facebook. This has nothing to do with you.
Well,
Facebook,
that's what my team was saying. They were like, Leslie, this is what we just have to deal with.
yeah, it's
Thank
Facebook.
you, but you did
It's a
a
nightmare.
great job. I was listening to you at times that I wasn't trying to fix
Yeah,
it, but you did a
furiously
great
fix it.
job.
Well,
Great job.
guys, this is Dr. Leslie Mancuso, and I want to talk to her about everything that she does and is. And basically, I could talk to her for 6 hours, but we're gonna like make that a little less time. And I want to ask Dr. Mancuso, can you tell us about who you are and what you do?
Well, Janie, first, let me thank you and let me congratulate you for all that you've done with your organization. I mean, I'm so impressed. The more I read about what you've done, the more I read and listen to the nurses. It's truly inspiring to be part of a network of nurses around the world. So, obviously, I'm Leslie Mancuso, and I'm a nurse first and the president and CEO of Jhpiego second. And I say that purposefully because my passion for nursing today is as strong as it was when I began my nursing career in 19. I did hear you say that 74, when our organization was started, was around the time that you were born, maybe? Is that what you were
71.
saying?
I was
Yeah,
born
it
in
was a little
71.
frightening to me to hear that, given that I started my nursing career in 1978. But I have had the distinct pleasure of leading this large international nonprofit that is, as you said, affiliated with Johns Hopkins. And when I travel, oftentimes people call me doctor because I have a PhD. And I feel very strongly that the audience, wherever it is around the world, needs to know I'm a nurse. So I always ask them to introduce me as a nurse. And if they don't, I make sure that I do it. But without question, nursing for me has been a passion, and I believe I'm a good CEO because I'm a nurse. And there's no doubt when I took over this job 18 years ago, there were very, very few women as leaders of any international health organizations. Few, maybe one that I knew of, and there were no nurses. And for me, that's very sad. So my goal is to make sure that everyone knows that nurses can be in any position they want, and they certainly should be in leadership positions around the world in all different areas. And so that's a lot of what we do. I mean, we're an international NGO. We're nurse-led. 1 in 5 of our employees, and we've got 3,200 employees. 1 in 5 of my colleagues are nurses or midwives.
Oh, wow.
19% of the published papers that Jhpiego does are done by nurses. We work with nursing councils and nursing associations around the world. Our goal is to make sure that nurses are part of every fabric of our organization. So we have nurses that are country directors, technical leaders, vice presidents, managers, and the like. And it's our goal to make sure that they are part of who we are. And so I could talk about our organization however you want it, Janie. I want to make
Well,
sure it's a dialogue, but
Leslie, I wanted to actually throw something in that I thought you would find amusing, and also
yes,
it kind of backs up your case as why why nurses have to be in the boardroom, why nurses have to be
right,
on the committee. When
right.
a hospital that I worked in, the new beds that we got were decided by a bunch of people with clipboards, okay, and they didn't
Right.
fit in the elevators. And any nurse anywhere would have said, does this fit in the elevator?
My
Let's
point
check.
exactly.
And that
Hmm.
is
Hmm.
exactly what, nurses belong on these committees. We belong on these boards. We belong in the work to create healthy communities. And that is what you do. And I got to tell you, that is an amazing dream for me to be like, to be able to do something like that. That is, I mean, I could spend the rest of my life happy like that. And I'm so glad that someone like you is doing it and that you are a nurse first. What does Jhpiego
Thank
do?
you. Thank you. So we're an international NGO, as you said, and our whole focus is about improving access to healthcare services for all those that need it, no matter where they live, no matter what their economic level is. And so our work is really about working closely with governments to help them identify their biggest health challenges, work side by side. Again, when you're working with the government, you're also working with the communities, the nursing schools, the nursing councils, the medical councils. Again, we are an interprofessional team in Jhpiego. And so what we're doing is we're working side by side with them to develop innovative, sustainable solutions and then to implement, because it's no use having solutions if they don't get out into the country and they're able to do that. So I have a staff of about 3,200 staff around the world. We're working right now in 39 countries. We've worked in 155 in total. And we work in all different areas, from HIV/AIDS to maternal child health to family planning, cervical cancer prevention, malaria, and of course the pandemics and infectious diseases. And we were very close to the Ebola crisis, and that was in Liberia and Guinea. Our nurses and midwives were in the front lines there, and now happily we're going to start working in Baltimore to bring our experience from Ebola and contact tracing into Baltimore, working with the Baltimore Health Department and many other partners. So we're actually thrilled that we're able to bring an expertise that we've had all these years around the world and bring it back to the United States.
It is amazing that
That's just a little bit. That's just
I know.
a little bit.
It is amazing that so few people in the US actually know about Jhpiego, because your mission has been largely international. And when I was
That's right.
clued in about Jhpiego, I was like, why didn't I know about these people? It's not, I mean, they should be getting like accolades and confetti, and I haven't heard a word about them. And it was actually a little bit frustrating for me, because there was this nurse leader over here that I could have like at some point contacted who I didn't know about. So I think if you're bringing your work to Baltimore, that we want people to know about Jhpiego and about what they can do to help, honestly, and what they can do to support your mission. Because, I mean, what is more worthy than making sure that women and children reach their expected lifespans? What's
That's
more
right.
worthy than that? I mean, women all over the world, I mean, we know that minorities and that people who live in the third world disproportionately die in childbirth. Their children are taken out by vaccine presentable illnesses. I mean, these are things that are so amazingly just important for everyone to know. And you're going to now, you've taken out Ebola, and now you are going to hit COVID-19.
Well,
So
we're
cool.
working in COVID-19. It's amazing to me, but I'm very fortunate to have this incredibly talented, committed colleagues around the world. And COVID-19 is affecting us around the world, as you know. And, so we can talk about that at some point. But certainly we're working with COVID-19 in a number of countries. I would say the majority of our countries it's affecting. And no doubt it's nurses that are sitting on the front lines in South Sudan, not only making sure they teach people about infection prevention, but also making sure that the HIV positive clients are able to get their medicines during this time period. And it's, nurses that are in mobile units and along with their colleagues, physicians and other, testing people in South Africa. And we've got, nurses in Mozambique that are using digital learning to help other people in the country learn about infection prevention and good infection practices. So we've got lots. In Nigeria, we're setting up these centers for this emergency to make sure that everyone knows what's happening with COVID-19, and certainly to bring it back to the States, and see here in the United States. I mean, something that we know readily is, unfortunately for us, it's affecting our Black communities, our Hispanic communities. It's certainly affecting low income and the poorer communities in a greater way. And it's something Jhpiego has seen. We see this everywhere. And sadly, what I've said to people is, like, not an equalizer. It's a magnifier of the inequalities that exist in our country as well as around the world. And I think hopefully it's opened everyone's eyes to looking at the challenges nurses and others are having with COVID-19.
It is amazing how much more it does impact the inner city and our urban and poorer areas. I personally work with a vulnerable population. I work for the VA, and we have a huge homeless community. We have a huge substance abuse community, and it's, and a lot of people, of course, everybody knows that veterans are one of the largest populations of hepatitis C, which we're now being able to control. Thank goodness. And of course, HIV was also endemic in the population. And seeing, like, in the first world here with me dealing with these patients, and then thinking of you dealing with them in the third world and making sure that they get their medications, that they get what's going to keep them healthy for, with their underlying conditions. I mean, it must be.
I think that's our worry. I think as nurses, that is our worry. And I see it in our nurses, and I know the nurses here feel the same. We've got clients that need their care, whether they have oncology issues, whether they have heart issues, whether they have, I know in our world, we're trying to make sure that maternal child health services stay open and that HIV/AIDS services continue. And so at the same time, you're trying to deal with COVID-19, our nurses are also trying to mitigate the effects of COVID-19 and make sure that care exists for all people anywhere. And of course, those poorer communities are the ones that are really at risk, and I worry.
I do too. And actually, I work in cardiology. I do electrophysiology. So we have people who are sitting at home wearing external defibrillators at this point because we don't want to bring them in, or they don't want to come in to get a permanent implant. Also, everybody's talking about where have all of the heart attacks gone, because our numbers for MIs have gone way down. And where are they?
That's right.
They're here. Right. They're out there still. They just didn't get any care. That's right. Terrifying.
It's terrifying. It's terrifying for all. It should be terrifying for all of us. And certainly here in the United States, it should be very concerning for us.
Absolutely.
Because we're,
God,
Yeah. Tell me about, I want to hear how you started this, Janie.
Okay. All right.
I want to hear, because I'm telling you, I'm so impressed with what you've created. Tell me how you started this.
Okay. It's a funny story. I actually created it because I was mad. I was angry. And so what happened is the Miss
You're
America,
a nurse.
I got it. I'm a nurse, so when I get mad, I make stuff happen. So we had a Miss America candidate in 2015 named Kelly Johnson, who was a nurse, and she gave this gorgeous monologue about this patient that impacted her life and long-term care, and it was beautiful, and it really touched me. And then the next day on The View, which is a talk show, if you've never, I didn't know it was a talk show until this happened. Oh, look, they're all saying The View and they have the curse word emoji. Nobody likes The View and show me your stethoscope. So, by the way, guys, if you have any questions for Leslie, type them in and we'll try to answer some. So, so anyway, I got mad and I thought about it all day. I was at work and I was just simmering about it, and I got home. And I created a Facebook group called Show Me Your Stethoscope because of the comments with, why is she wearing a doctor's stethoscope? How did she even think that she could win? That isn't a talent. And I was like, why are these powerful, wealthy women with this huge platform denigrating this nurse? The one place where women have been able to be on boards and be in charge and be able to to do the things that we are certainly capable of doing. And all they could do was denigrate this poor nurse. And I was just like, oh, the heck with you. And I created Show Me Your Stethoscope, because I live in Missouri, the show me state. So I put that on there. And I
That's
thought,
where you got the show me.
yeah.
Okay.
So I got like 50, I thought like 50 people from the ER were going to pop in and show me a picture of them with their stethoscope. And now we have over 600,000 nurses and other healthcare disciplines in this group. And we've been a part of a lot of different things. We do, oh yeah, Kara, women taking women down. It's terrible. Why would we do this? I mean, women know that even though, you know, it's very nice to say that equality exists, equality does not exist gender-wise, you know, in the in the US. It doesn't exist, probably not anywhere. And we shouldn't, when we're powerful women, we should not poo-poo other women and act like they were dumb and humiliate them on daytime TV.
Well, and I think your comment saying that people's questioned why is she wearing a doctor's stethoscope is concerning in and of itself.
Infuriating.
Infuriating is exactly it. You know, we need to be beyond this, and there's no doubt that hopefully COVID has shown the world that nurses are the cornerstone of this pandemic, that they are serving as leaders. And, you know, certainly I would love more nurses interviewed on the media about what's happening and what these nursing leaders are doing to triage and to do everything that needs to be done in these situations. But I think, you know, certainly with COVID, we've seen a great deal of, you know, what I'm pleased about is people seem to be appreciating nurses, understanding a little bit more of their role. But I do believe if they're going to truly appreciate nurses, they need to support them, they need to invest in them, and certainly they need to protect them. And that, for me, is a concern, you know, because we've seen that that's not happening. And, you know, I worry, like the International Council of Nursing that's come out and said, listen, you know, we need to focus on PPE. We need to focus on, they have an action plan that's focusing on infection prevention. We need to, you know, we need to do things to make sure nurses have the protection they need, have the financial security they need, because they truly are taking risks, as we know right now.
Yeah.
And so that's sad to me when I hear that they have to say that about a stethoscope. Or, you know, I no longer want to see nurses depicted in the way they are, because we should be in every level of decision making when it comes to healthcare, not only in this country, but in the country.
Absolutely. And frankly, the way that we are viewed by a lot of the public is the doctors help me type stereotype. And when, I mean, I started my career in ICU. And I went to the emergency department. And what I learned in the ER and the ICU was that I had better be on my toes, because I am going to catch the change in condition. I am going to be the one that does that. I'm going to be the one that notifies the physician. I am going to say this has deteriorated, or the worst thing, the thing I always hate saying, but have said and have been right, which is, I don't know what's wrong, but something is wrong. And then you find out that it's something fatal. Something that is about to be fatal. And I think that nurses need to be out there in front of people, like you said, being interviewed by the news, being put out front to show the public what it is we actually do, and that is not juggle bedpans. You know, we are critical thinkers and we are professionals. Kara would like to know what your biggest piece of advice for nurses who are in management positions but are struggling with a lack of support from upper administration.
I think first it's how we, number one, we need to depict that we're in control. So the first thing I'd say as a manager in a tough situation is make sure you're not going into it in a humble way, in the sense of you have a lot to offer. And therefore, you have to value yourself as a manager in that situation and value your opinion. So if you go in with that setting, meaning that's, you have a lot to offer, a lot to say, and a lot to be able to contribute, then it's a matter of going to those people and talking about what needs to happen and why she believes it needs to happen. And it's not easy, but that's where our roles as leaders, we're not made up of a profession that's 90% women. And we really need to help women to know how to, in these situations, take control, not go in as the underdog, but take control of the information and the data they have as managers and know that they need to contribute. And those people need to listen. And so now there's ways to do that. And so my advice is there are ways to do that. And there's different layers. I think sometimes you have to use certain strategies and other times you have to use other, because part of it is understanding that person and knowing, what type of person you're talking to. And so I think, but if you don't go in believing in your knowledge base, your professionalism, what you expect and need, then it comes across and it really doesn't change. So that would be my advice first, is stay grounded in your belief that you know more than they know, you are on the ground, and that they need to hear what you have to say, because it's going to make a difference in the patient population. It's going to make a difference in the health of the clients that they're serving. I'm not bashful, and I don't think any of us should be bashful. We have too much to say and too much knowledge and skills that we need to push that through. And I think it happens with any of us that have been women leaders or women execs. I mean, you have to learn how to maneuver. And I think it's really important that, but it starts with knowing yourself. It starts with knowing, you're not going in as an underdog. You're not going in questioning whether or not you should say something, whether or not you know something. You know a lot. Nurses know more than most on healthcare. I mean, look at, we're providing 80% of health services around the world. We're 30 million strong. We actually are a huge body with a lot of power, and we must believe in that power and use that power.
And I think that is what we don't do, because we are discouraged from using that power and individually threatened, and with lack of promotion or your job or lots of other things. And I think that when we came together as Show Me Your Stethoscope, and I said, Janie, what are you going to do with this? After, by the way, a couple of nursing organizations tried to buy the group from me. Just saying.
Credit to you.
I said, Janie, what are you going to do with this? And I said, you're going to do good. That's what you're going to do. You're going to do good, and you're going to give nurses a voice. Nurses are finally going to have a voice. And we have done that. We have changed things. And I feel like you have changed things, and you know what that feels like. We're a smaller scale. We're not Jhpiego, but we are, in fact, a formidable nation of nurses. And that is how we have shown up.
I don't think you can compare. You don't compare size. You don't compare what your mission is doing. You've got 650,000, right?
I know. Yeah, it's a lot.
Enormous. That's enormous. And again, it's that power of the voice. And I think we have to make sure nurses know what, just recently the State of the World's Nursing Report was launched, and you probably heard about that. WHO launched it. Yeah. Jhpiego was part of the development of that. Collected data from 191 countries. But in that were some of the things you were just talking about, Janie. The data shows that, we're a woman's profession, but there seems to be this glass ceiling for women moving up in nursing, and there's a glass elevator for men. We need to look at that. We need to look at pay equity. We need to look at hiring practices and auditing, and promotion practices. And we certainly need to look at enforcing policies and preventing and addressing sexual violence and harassment in the workplace. And that came out in that body of work. So I encourage people, I know it sounds like a lot, but if you can get your hands, you're going to see that some of the things that came out by this data, it's the first data we have on nursing around the world, is coming out just what you're saying. Some of those issues came in the data. That clearly we're not there. There's so much. They also talked about investing, and I liked that part, that there needs to be an investment in nursing. We need to invest in nursing education and accelerate nursing education because of the shortage. But we also need 6 million jobs to fill that shortage around the world. And we need to invest in leadership development. And I think that is really important, that we get some gender transformative leadership development, particularly for women in nursing, that helps us learn those skills as leaders. I think that's all important.
I think women very often learn the exact opposite at their daddy's knee. I mean, we do. We learn that, people want women to be nice and sweet and agreeable. And when sometimes the answer is not being agreeable, the answer is calling people and saying, why have you done this? How are we going to fix it? Let me help you. And we are often not as assertive as that. And I feel like we can be, but we just need to, as you say, invest in nurses and invest in nursing and what we're learning. And I feel like that,
and we need to demand a seat at the table. Janie, we need to demand that seat at the table. And that's a hard thing to do. I know it is. But we must be at that table when decisions are being made about healthcare and about all the areas we know as nurses. We need to be there. And that's going to be something that we need to push all of us to address. How do we get at that table? How do we make sure we're part of the decision making?
I love how you quoted Shirley Chisholm in that whole, if they don't allow you a seat at the table, bring in a folding chair. That's what has to happen. That is one of my favorite quotes. And when I saw you on a video talking about it, I was like, oh, this is my girl. That is exactly how we feel about this in the structure of Show Me Your Stethoscope. If they're not going to give us a seat, we're going to take a seat.
And I've seen that in your group. I've seen your nursing exchanges, and that's important. We all need to support each other. And if they don't know how, your network allows them to process through how to do that. I think that's the beauty of your network, is you're giving a voice to these incredible nurses. I hope it expands. I hope we give as many voices to nurses as possible. And we need to believe, when you're 30 million strong, we have a position of strength. We're not in a position of weakness.
All we have to do is insist that we are all treated fairly. And that is hard with hospital organizations, healthcare organizations, for-profit especially. It's very difficult for them and for us to deal with, but we can. And it's all about you guys watching. It's all about you taking these opportunities and investing in you, investing in yourself, because we already know you're invested in your patients, or you couldn't do this job. But you have to invest in you. You are so important. You are a national and a global resource, guys. That's who you are. I'm gonna get choked up about it. You know how I am about you.
I was just getting choked up when you said that. I mean, exactly.
They are very important to me, Leslie. They are the whole group. I know there's 600,000 of them, but I know so many from talking, and a lot of people private message me with their private problems and to see if I can help them. And I deal with people like nurses who are dealing with legal problems and sexual harassment problems and other things, and advise them through these things. And I'm going to tell you, every one of them is important to me. And I just hope that you are as important to you as you are important to me, ladies and gentlemen, because you are so important.
But Janie, thank goodness they have you, and thank goodness they have your leadership, and and you've been practicing, you have experience with what they're talking about, and you can give them the resources, at least, direct them to the right place. And you should be proud of what you've given nurses. You've given them the voice, and at a time that's critical for nursing. You've created this, and this is a real important time for nursing. Not only is the state of the world's nursing, it was the year of the nurse and the midwife this year, but you're also doing it at a time that people are seeing nursing with COVID-19, are seeing some of the realities of the inequalities in our health system, the fragileness of our health system, the fact that nurses can't get PPEs. So this is an incredible time for you, and what you're doing for nurses is invaluable right now. I mean, I haven't been one of those writing to you, but I might. But I must say, it is really necessary what you're providing these nurses right now.
I think with the world more connected than we have ever been, we can feel extremely disconnected as professionals.
Yes.
And I think that the connections they make online and Show Me Your Stethoscope, we try for them to be positive ones. And I hope that we continue doing that. And I honestly, Leslie, I'm totally stoked about even getting to chat with you about this, because I want everybody to see what a nurse leader looks like. Look at her. She looks just like us. Guys, looks just like us. And she's directing this initiative that, I mean, you could do that. You could direct an initiative. You can.
Absolutely. And I want them to do that.
Exactly.
We need nurses. The fact that still today, there's very few, I think there's one, but there's very few nurses that are in international organizations at a leadership or even a vice president level. There's more at a vice president, but we need many more. And so, we need nurses to step to the plate and be the leaders they can be, because we know they can be leaders. They are leaders already.
It takes a long time, but join the committee, finish the degree, apply for the promotion.
Yes.
Don't sell yourself short. That's Leslie has told you that in a lot, better words than I can, obviously, but she's told you that you have to, the investment we need to make in nurses, in each other, is the most important thing we can do right now. And I am just grateful that I was able to have Leslie on to talk about this. So it's not just me preaching to you that you need to get out there and do stuff. It's, it's somebody else with a PhD. So it's much more valid now.
Well, I think, I think all our experiences make a difference, and everyone's going to choose what they want to do as nurses. I mean, I obviously started as an ICU nurse, and I taught nursing, but everybody finds that niche for themselves, and to be at realizes we need the skills to be at that table. So if it's a policy table, we need to make sure that we have the policy knowledge and the understanding. And I think that's the importance right now, is we make sure nurses are getting those backgrounds so that there's no question as to why we believe they need to be at that table making decisions.
Absolutely. Guys, I don't want to keep Leslie on here forever, because it's been, a while, and I am totally taking up her time, which probably, 20 people around the world.
I know. I wanted to hear about your work in food security. I know you do a lot of work in food security and your commitment. Do you mind if I ask that before we close?
Yes, let's do it. So I actually, many years ago, was working in a pediatric hospital as a tech. Okay. And there was a child who was about 600 pounds and 16 years old, and he died of heart failure from obesity, because his poor mother was working 3 jobs to keep food on the table, and gave the child money to go to the local McDonald's for meals, because they lived in a food desert and there were no grocery stores. There were no healthy restaurants. This child died of this. And in my head, I call him Death by Big Mac Kid. I know his name, and I also know his name. I will never forget his name, but I'm obviously not going to tell you guys. And this poor child died of living in a food desert and being poor. That's what he died of. So when I ever get this master's degree finished and start my doctoral work, my plan is to look at what the health markers look like in these food deserts and try to get the USDA grant requirements changed for what constitutes a food desert. There are currently in just my city 17 neighborhoods that are food deserts that don't qualify because they have a bodega that sells a couple of different things, but they mostly sell cigarettes, beer, and lottery tickets.
Right.
And there's no real healthy food there, but because they barely meet the requirements, the people in the area can't get healthy food. And I volunteer for a community garden. I do my own lots of gardening, and I donate, produce. And when I kept chickens, we're not doing that right now, but we'll go back to it. Donated produce and eggs to our local food pantry that would take it. Not all of them will take it because they can't, which is kind of silly to me, but I get it. Everybody has rules. Food security is a huge deal for me. I never personally experienced hunger, but the look in that child's eyes as he was conscious, dying on a ventilator, for the rest of my life, I will never forget those days. And I want to make that change as a nurse for other people, which is why I have plans for urban mission trips in the US that I want to do with nurses. These nurses, the ones watching this, that I want to do with these nurses to take care of these populations in these cities. And there are some similar populations in rural areas, especially in places where the industry is all closed and they're all starving. And when you're your mom, you know that you don't want to feed your kid hot Cheetos and Mountain Dew for dinner. But if there is there's nowhere to go to get it, and you can't, how are you going to do that? So
this is nursing, Janie. What you're talking about is nursing. We don't look at just this child that was in that state, that was on a ventilator. We look at everything else. What helped this child get to this point? What can we do differently? And as nurses, this is nursing. You're able to do what you're planning to do for your dissertation because you're a nurse and you have that lens of nutrition and understanding what good nutrition does to the health of someone. And then a good, healthy nutrition of someone makes them a much more productive citizen. That makes our economies much more thriving. And so I'm thrilled that you're looking at this. I think and I love that it's a nurse looking at this.
It is a passion for me, honestly. If I could get IRB approval, I would want to compare people from the same zip code in prison that are incarcerated, health markers with them and the people who are out in the community, because I think we would find out that the diet of people who are incarcerated would actually be better than these poor children in these areas. And so I could talk about food deserts for like 6 hours as well.
I just wanted to hear about it because I know that's an area of interest. And again, what we're talking about today is all the roles that nurses can play in our world today. And we should feel that we can take on any role we want. And what you're talking about is nursing, is looking at issues around the health and the well-being of the people we serve and we care for. And I think it's
solving
great.
it. Solving it is what nurses
that's the
do.
key. Yes, that's the key, is being innovative and solving it.
Lots of people study things. Nurses solve problems. We are problem solvers. That's what I love about being a nurse. So guys, just a couple things before I let Leslie go. Leslie is going to have a salon for us over in the Holly Blue app, so download that if you haven't, because I'm going to be there because I'm excited to be able to just, ask Leslie some questions, and to me, that's like, oh, look, it's Christmas, because we're going to have a great time with that. And I just want to thank Leslie for taking out so much time of your busy schedule to talk to us. And I see that I don't even have to thank you because it's a pleasure, because you are a nurse first. That's who you are.
I am. And I thank you for letting me meet all these nurses that are online. It's truly, I get emotional because it's my privilege. It's really my privilege to get to speak to nurses around. I'm very passionate about nursing.
I can see that, and thank you so much for all you do for everyone globally that you touch globally. Globally, nurses, you can do this. All right.
Thank
I
you.
love you guys, and I will talk to you on another episode of the Shift Report.